Robert, so thank you so much for coming in. Dr. Zhu and I, we also want to share your story
Certainly.
that you went through with your foot. And
Okay.
obviously, it's not happened overnight, but it's progressively worsening as your work conditions and all the pain and discomfort that you start feeling from the beginning to end.
Yes.
All right, so your story is quite a story that we've been follow you, and initially Dr. Zhu saw you initially, and you've been
He did.
to so many different doctors
I had.
for your condition as well. Because of this, I think it's make your case is really stand out, and a very common condition for most of the patient, and because of it's something so simple, but it could be so aggravating and be debilitating.
It was very debilitating, Dr.
Right.
Wen.
Yeah.
The pain.
Yeah, so that's why we're here. We want to share that story to
Okay.
most of the people who don't know there's an option or solution out there
Mhm.
that can be doing something to alleviate the pressure, the pain, the discomfort, that get you back to somewhat normal. That from the day that you never have pain on your foot.
Yes.
All right.
Yes.
So,
Sure. Certainly.
So can you share with us, like, how did this start out with your condition? Is it start out with just a heel pain generally, and then you went see different doctor, and what the other treatment that you got done?
The way that it started was it was my right heel. It was a chip that I had injured, whether it was through running or exercising. A chip was formed on my heel, and it just caused debilitating pain. And I went to multiple doctors. Dr. Zhu prescribed orthotics that helped some of the pain, but it wasn't until I came to your practice that I got the care that you guys give, and it was so far it's been great.
So you went through. Have you ever had injection? You went through, I would say, all the conservative option, right?
I had the
exercise.
cortisone injections, a couple of them, I believe, shockwave therapy. And that seemed to alleviate. I think I had 2 treatments of that, and that seemed to help as well. I've gone through the traditional, came to you guys. You're very untraditional, very, very amicable organization, and it just everything was really, really well.
So most of the time that the patient came to us, they already went through a lot of different treatment conservatively. Stretching exercise, physical therapy.
Physical therapy,
right?
many bouts of physical therapy.
Many.
Dr. Wen.
Yeah, so and when we went through this conservative option, but the outcome, the improvement is not as the point that get the patient back and walking comfortably,
Right.
then that's usually is prone for a different solutions, which is what we did in the
Okay.
office, right?
Mhm.
On that day, what happened? We did the procedure in the office.
You did.
You were awake
I did. I
with
did.
your wife right next to you, right?
Yes, sitting right here, as she always was.
Right. And what do? That we remove the bone spur,
Mhm.
right? And that be able to get you the pain, alleviate that pain whenever you touch that area.
Right.
But because your condition has been going on for so long, it's compromised with the calf muscle, with the Achilles tendons,
Yes.
right? So
Yes.
that we had to do some physical therapy afterward to regain some of that function back. So Dr. Zhu, you took care of Robert.
Right.
So how do you feel about his progress since the first time that you met him?
Well,
Now.
before I go into that, I just want to kind of get into, because I started treating you first, obviously.
Yes, you did, sir.
And then I implemented all the pretty much conservative therapy and somewhat invasive therapy that our office had to offer. But the thing that I have to add to your case is that, yes, you had a chip, either fracture or calcium deposit or some type of injury that precipitated all this, but you did come in with a history of working for the Postal Service as well as working at Lowe's,
Right.
like a construction store, walking on cement floors for many, many years, right?
Yes.
Yes.
That's true.
I mean, that did not cause it, but that did not help it either,
It
in your
aggravated
recovery.
It aggravated it, yes.
Right. In the beginning, we implemented orthotics, injection therapy, and in the beginning it did work. I mean, it kept you kind of going every 6 months or so. You needed those therapy to be repeated,
Yes.
like a repeated cortisone shot, new orthotics, but eventually it was not kind of getting rid of that permanently.
It wasn't.
Yeah.
It wasn't.
And at that point, we implemented a semi-permanent solution, which it was the shockwave therapy.
Shockwave therapy.
Yeah, can you describe your experience with our office with shockwave therapy?
It was very, very professional.
Okay.
It was explained every step away. It was explained in very good detail.
Right.
I was very comfortable. I wasn't apprehensive at all in it. The follow-up care, I don't recall the person's name afterward, called and asked for how did it go, any problems. No, it was worthwhile.
Okay.
It wasn't something that was handled by the insurance, but it was well worth doing anyway.
Right. And I was gonna get to that. It was a service that we provide here at our office.
Great.
It was an in-office procedure, all right, where you had to get just one Novocaine shot, pretty much, to numb up the heel.
Yes.
And then it was kind of pain-free from there for
Yeah,
the
there was
rest
no
of the
pain.
procedure.
Yes, right. And what was nice about it is that it was offered a second treatment if necessary.
Correct.
And I took advantage of that, and that was.
Yeah, and then that got you over the hump pretty much for another 6 months to a year.
Yes.
After that, and then at that point we kind of figured that all the therapy that we implemented was not what we call a permanent solution for you, meaning that all the therapy that we implemented, even though it worked, but there was going to be flare-ups and there was going to be recurrence of pain.
Yes, it wasn't going to go away completely.
Right.
We needed to do something a little more invasive, not
Correct.
minimally invasive.
Correct,
Right.
exactly. And Dr. Nguyen, did perform the minimally invasive procedure again in the office
Yes.
while you were awake, and you already kind of said your experience with that.
That was fine. It was.
Yep.
It was. Everything about this organization, about this doctor's office, is top notch.
And
It's the different options that you guys give.
right.
Who knew about shockwave therapy? It just, yes, it was completely satisfied with this office, this practice. Both Dr. Wen and Dr. Zhu are great podiatrists.
And one last thing I want to kind of cover with you, which is why I want to hear from you, and a lot of future and current potential patients with your similar situation or similar condition want to hear, which is, it's obvious that medically speaking we cannot
Sure.
give you a new foot.
Not yet, anyway.
It's not, no transplant yet. Right, correct. However, the goal here was not to get you back 100% normal, like Dr. Wen said. Was not going to give you feet that was like when you were in your 20s.
Yes.
But just describe to us, like at this point, even though you're not fully recovered to go back to work, but how's your daily activities, quality of life, all these implementations that we perform, all the therapies, how's that contributed to your daily life at this point?
I think
quality
I'm
of your
pretty
life?
much back to much normal as I'm ever going to be.
Okay.
Because of this office. I get it's never going to be perfect again.
Right.
But it's light years better than it was.
There you go. That's what we want to hear.
I thank both of you. Every day.
Yeah. Thank you. Well, thank you for that.
If you have problems with your feet, this is the place to be. They'll fix it.
To find out more about minimally invasive foot treatment, contact Feet and Beyond at 908-576-0880 or visit feetandbeyond.com.